Okay, all, welcome to EarthShift Global's August Brown Bag webinar. My name is Tess Konovich, and I'm the Scientific Marketing Manager here at EarthShift, and it's my pleasure today to introduce Jono Drew, who is a New Zealand-trained medical doctor who is currently undertaking doctoral studies at the Centre for Planetary Health and Sustainable Care at Dalhousie University in Canada. His research focuses on the environmental impacts of healthcare. He is a Vanier and Killam Scholar and currently serves as a commissioner with the Lancet Commission on Sustainable Healthcare. And he prepared these slides along with Daniel Rainham, who is a full professor in the Health Promotion Division in the Faculty of Health and holds cross appointment in the Department of Community Health and Epidemiology. He is the academic director with the Center for Planetary Health and Sustainable Care and is an affiliate scientist with Nova Scotia Health. He has a PhD in population health science from the University of Ottawa and leads research focused on associations between environmental conditions and human health behaviors and outcomes. And Jono will be leading the presentation today, so take it away.
Thanks, Tess. And hi, everyone. It's really nice to be here today and to have the opportunity to connect with you all. As Tess mentioned, unfortunately, my colleague and PhD supervisor, Daniel Rainham, wasn't able to join us today. So I'm going to do my best to cover his portion of the presentation as well. So yeah, my name is Jono. I'm from Aotearoa, New Zealand. I completed my medical training in New Zealand and worked as a junior doctor or medical resident in the local healthcare system there for a couple of years. And then last year, I relocated to Halifax, Canada to commence doctoral study at Dalhousie University with the newly formed Centre for Planetary Health and Sustainable Care. Again, as Tess mentioned, I'm very lucky to be supported by both the Killam and Vanier scholarships, as well as an NSERC research grant focused on sustainable health system transformation that Daniel leads. My PhD research essentially poses the question, how can we provide quality healthcare for all while remaining within planetary boundaries? And this work sits at the intersection of various disciplines, including industrial ecology, ecological economics, health system performance assessment, and global health. While I'm happy to talk about any of that in the Q&A later, my focus today is going to be on the expansion and development of healthcare sustainability science more generally over the past decade or so, drawing on insights gained from the HealthcareLCA database. First, though, I wanted to briefly position our research center's work in a broader context, beginning with a land acknowledgement, which recognizes that Dalhousie University and our Research Center for Planetary Health and Sustainable Care operates in the unceded territories of the Mi'kmaq, the Wolastoqey, and the Pesca de Magadi peoples, and that we each carry collective obligations to the original peoples of these lands, as well as traditional ways of knowing, especially in the context of this work in relation to resource stewardship, sustainability, and respect for the natural environment. I also want to acknowledge that we are collectively living in a geological period that's characterized by really unprecedented disruption of Earth's vital systems, the systems that maintain stable and habitable conditions for not just humanity, but life more broadly. We now face what some people are referring to as a polycrisis of climate disruption, biodiversity loss, geopolitical instability, antimicrobial resistance, increasing inequality, and so on. While half of the global population still doesn't have access to adequate healthcare, these interrelated and amplifying threats risk undermining the progress on global health that has been achieved over the past century or so. Our healthcare systems, therefore, face really immense challenges, not only in terms of improving access to healthcare and building resilience, but simultaneously reducing environmental impacts as well. So just for some perspective, Here we're looking at the global health system's contribution to a range of environmental impact categories, including climate change, water use, particulate matter, and so on, with impacts represented as a proportion of the global total. So if we take climate change as an example, we can see that healthcare is responsible for around 2.4 gigatons of CO2 equivalents per year, or around 4.5% of global annual greenhouse gas emissions. And this is around twice what the global aviation sector is responsible for. We can also see that healthcare contributes a similar share to global air pollution emissions, with estimates suggesting that this is responsible for the annual loss of around 4.6 million years of life due to ill health, disability, or early death. So these are some of the challenges that our Centre for Planetary Health and Sustainable Care aims to tackle, co-led by Professor Daniel Rainham, who couldn't join us today, and Sean Christie, who's a neurosurgeon and professor at Dow. The centre serves as an interdisciplinary research and training environment that's committed to exploring the complex interconnections between human health, environmental sustainability, and equitable care systems. The centre's website is still under development, but if you did want to check it out or to connect with us, you can do so at the address listed here, sustainablecare.ca. Okay, so I'm going to move on now to the focus of today's talk and discuss HealthcareLCA, which is an online data platform that I created several years ago alongside Chantal Risen, who's now at the National University of Singapore, as well as Sean and Daniel, who I mentioned on the previous slide. I'm going to first introduce the HealthcareLCA database, what it does, how it works, before discussing the evolution of this literature more generally, and highlighting some challenges and limitations of the current evidence base. Before I get started, though, I did want to acknowledge the platform's current and former sources of support. So HealthcareLCA receives support from our centre, as well as the Centre for Sustainable Medicine, or COSM, at the National University of Singapore. Earlier on, between 2022 and 2024, HealthcareLCA was supported by Cascades, which is a pan-Canadian sustainable healthcare network based out of the University of Toronto. And this support has enabled us to bring on a data analyst to lead the maintenance and upkeep of the database over time. So I also wanted to just acknowledge Sage Mosgrove, who's been serving in this role for several years now, and really without whom the database simply wouldn't be where it is today. So what is HealthcareLCA? HealthcareLCA is a database that serves as a global living repository of healthcare-related environmental impact assessments. So while researchers around the world, perhaps including some of you here today, are working hard to both assess and identify ways to reduce environmental impacts of different aspects of healthcare, the HealthcareLCA platform serves as an up-to-date repository for this work, bringing together new and existing assessments into a centralized location. The database is very broad in scope. It includes research related to really any healthcare field, including medicine, surgery, dentistry, pharmacy, primary care, and so on, and conducted at any scale, whether it's at the equipment, pharmaceutical, procedure, service, or system level. We include studies using a range of different methods, from carbon footprints and life cycle assessments through the top-down input-output-based approaches. And finally, our interactive database is housed under an open access license, meaning that users can freely explore the available data to filter it, sort it, search it according to their own needs and interests. So why do this? What is the purpose of HealthcareLCA and what value does it have? Well, general awareness about the health sector's contribution to global environmental change has been growing in recent years, as has willingness to transition toward more sustainable modes of care provision. So we now have 45 countries that have committed to achieving net zero health system emissions, and a total of 84 nations have committed to sustainable low carbon modes of care delivery. An important question, though, is how are we going to get there? How are we going to decarbonize healthcare? What even does a sustainable net zero health system look like? Our success, I think, mainly hinges on two things. Firstly, the rapid quantification of healthcare's environmental impacts across all levels of service provision. And two, the timely communication and ready availability of this data for various stakeholders, including health sector managers, policymakers, procurement teams, healthcare administrators, healthcare workers, and even patients themselves. And it's really this latter aspect, the communication side of things, that HealthcareLCA is intended to help with. So in order to demonstrate how it might be achieving that, how HealthcareLCA can serve as a knowledge mobilization tool, I'm going to play a short video now, which provides an overview of the platform, essentially showcasing its various features and navigation tools. If you've seen this video before, or you're very familiar with the platform, please feel free to take 10 minutes, stretch your legs, refill your cup, and we'll regroup shortly again afterwards. So here we are on the gallery page. If we scroll down, we can see a gallery view of all of the studies that are included within the database to date. This page offers a visually appealing view of the data, with each individual tile representing a single study. By default, the data sources are ordered by publication date, with those most recently published appearing here at the top. I'm going to click on one of these tiles. Let's start with this one here that looks at the environmental impact of surgical scissors throughout their so-called life cycle, meaning all the stages involved in producing, packaging, transporting, reprocessing, and disposing of them. So we can see a pop-up summary of the data source, including the study's title, authors, publication year, abstract, citation, publication date, link to access the study itself, publication type, and the journal it was published in. We can then see the individual products and processes that had their environmental impacts evaluated. And as we scroll down further, we can see information about the study's methods, including its setting and functional unit, the unit on which environmental impacts are compared, in this case, one use of a pair of scissors, the boundary of analysis, in this case looking at the entire product lifecycle, which lifecycle stages were included in the analysis, and which environmental impact categories were assessed. In this case, a broad range of parameters, including climate impact, as well as acidification, eutrophication, ecotoxicity, and so forth. If you're not sure what a certain data variable is referring to, you can simply hover over the little I symbol for a definition. At the very bottom, we can see the competing interest statement and funding declaration from the study. If you're finished looking at a particular study, we can close the pop-up by clicking the little X or anywhere outside the box and return back to the gallery view. Now you can continue browsing through the gallery if you like. There are currently close to 200 studies included. So I'm just going to come back up to the top now and show you the filter and search functions, which you can use if you happen to have a particular interest or question in mind. So let's say we're interested in studies from a particular country. We can click the filter button here, choose to filter by country, and then toggle on and off the countries of interest. For example, if we only want to view studies from the UK, we can click here, or if we want to view studies only from the United States, then we can toggle off this button and toggle on here. We can also combine filter conditions. So say we're interested in studies from the US that are related to surgery. We can click here, add a new condition, filter by healthcare field, and then select surgery. Even more specifically, Perhaps we're interested in US-based studies that looked at the impacts of surgical procedures. Then we can add a further condition based on the scale of analysis, like this. If at any time we want to remove any active filters, we can simply click here again and then click the trash symbols like so. You can also search the gallery by selecting the search icon up here. This allows you to type in any keyword of interest and be shown the relevant studies. For example, if I type in face mask, it will highlight any study that makes reference to face masks. So we can see here that there are 11 search results, and we can toggle through them by clicking the arrows here. Once you've finished searching, you can simply click the X here. So that's a quick summary of the gallery page. Let's move on now to looking at the database in a more traditional format. So I'm just going to click up here on the database tab. So here we are on the database page. This presents the same studies that are shown within the gallery, but in a spreadsheet format. The key difference between the gallery and this view is that here we can begin to explore the environmental impacts that have been reported within each study. The Products and Processes tab in the upper left-hand corner of the spreadsheet is the default view. In terms of the way the information is presented here, you're seeing a more detailed breakdown of what each study actually assessed. Let's begin by looking at the same example that we looked at previously, which was surgical scissors. I know it's right here near the top, so I'm just going to scroll down a little bit and find it. So as we discussed earlier, this study examined the environmental impacts associated with the life cycle of these scissors. More specifically, we can see here that impacts were reported across 3 different reprocessing pathways. In other words, different steps were taken to allow for the ongoing reuse of these scissors in a surgical setting. These included not repairing them off-site, and repairing them on-site. So if we scroll across, we can see all of the same information that was presented in the gallery view, including all the descriptive details about the study and its methods. The key difference is that at the end here, we begin to see the actual numerical impact values. So sticking with our surgical scissors example, we can see that the global warming potential, or climate impact, is reported on, as is ozone depletion potential. And if you continue scrolling across, you'll see all of the environmental parameters that were assessed by the study. To compare impacts more easily, I want to show you the hide fields function. So if we click here, we can see that all data fields are currently displaying. So let's begin by clicking Hide All, and then selecting the ones we are most interested in. For example, country, year of data collection, functional unit, system boundary, and global warming potential. So we can now easily see that over the entire life cycle, from cradle to grave, one use of a pair of surgical scissors is associated with between 0.05 and 0.07 kilograms of CO2 equivalents, depending on how those surgical scissors were reprocessed, with on-site repair being the most climate-friendly option according to this study. Okay, so let's switch it up a bit now and look at how we can filter the data according to our individual needs. To begin, let's say we want to learn about the climate impacts of different drugs. We can come up here and select Filter, just as we did on the gallery page earlier. If we choose to filter by scale, we can then adjust the toggle settings to be shown only those studies that relate to pharmaceuticals. As we scroll down through the results, we can see impact estimates for various pharmaceuticals, including vaccines, antibiotics, analgesia, monoclonal antibodies, anesthetic agents, and so forth. Alternatively, we might be interested in clinical investigations, and we can simply adjust the filter settings here to toggle pharmaceuticals off and investigations on. Now we can see the climate impact of different laboratory tests and imaging modalities. One aspect of the HealthcareLCA database that's really neat is that it documents contributions to numerous environmental impact categories,
not just climate change. So, for example, we might be interested in the ozone depletion potential of healthcare equipment. And so we can simply adjust our view to reflect this by toggling off global warming potential and toggling on ozone depletion potential. And by filtering the database to show equipment-related studies only. We can then see ozone depletion potential estimates for different items of healthcare equipment, wherever they were documented by the original studies. Finally, I wanted to show you some of the higher level data that focuses on the climate impacts of national health systems. So if we switch back to global warming potential here, and then adjust our filter settings to show only those studies conducted at the system level, we see a long list of health system impact estimates. If we tidy this up a little bit and use the group function to group estimates by country, and then the sort function to sort estimates by year of data collection, then we can easily see available estimates of annual greenhouse gas emissions associated with various national health systems, with the most recent estimates listed first. So that's a brief summary of how to navigate our database. Before we finish, I just wanted to show you the HealthcareLCA search tool, which can also be found on the database page. This search tool allows you to search for any keyword and be shown any and all matching results. For example, if we search for inhaler, we will be presented with a long list of all of the various inhalers that have been studied to date. If we want more information about a given record, we can simply click on it and see a pop-up summary with the impact estimates listed right here at the end. That concludes this tutorial. Please explore the platform yourself by going to healthcarelca.com. If you have questions, our contact details are available on the website. Thanks for listening and take care.
Okay. So welcome back, everyone. I hope that you found the tutorial useful. I'm going to move on now to talk about the expansion of this research field more generally. So when we launched our database in late 2022, we published an accompanying review in the Lancet Planetary Health that both demonstrated the emergence of healthcare sustainability science as its kind of own independent research field in the early 2000s and highlighted its exponential growth ever since. And this can be seen in these charts here from that publication, which summarize the cumulative number of data sources in the database up until the end of 2021, disaggregated by scale of analysis, healthcare field, world region, and income category. Since our initial review article was published, this exponential growth has continued, and we've seen the database more than double in size once again, from around 150 studies to now nearly 400. Based on this historical trend, the field is roughly doubling in size every 3 years, with the current data set including a total of 8,000 individual environmental impact estimates for more than 3,000 healthcare products or processes. Interest in this field is not only demonstrated via the growth of new studies, but in the number of users what we're seeing across the platform. To date, we've seen around 30,000 users, 1/4 of whom are returning users, meaning that they have used the database more than once, which is always reassuring to us. Users also span more than 100 countries, and we've totaled more than 350 hours of user engagement time. More importantly, though, this growing evidence base has provided really useful insights at multiple scales of care provision. To name just a few examples, at the system level, we've learned that many high-income countries have considerable scope to reduce their health sector emissions without compromising care quality. At the procedural level, We've learned that anesthetic gases and equipment supply chains are key hotspots of surgical procedures. And at the product level, we've learned that reusable equipment is typically superior to single-use equipment in terms of its environmental performance. I know that you can't see these figures very well, but if you're interested, they can all be found in our journal article that I was referring to earlier. So in a span of 1 to 2 decades, since the earliest efforts to measure healthcare pollution, the advancement of healthcare sustainability science has resulted in quantitative estimates of healthcare's environmental impacts now being available, albeit to various extents, across most healthcare disciplines, covering primary care to specialist care and individual products to entire health systems. As exciting as this might be, depending on your personal interests, I think it's also important to take stock of the quantitative estimates that are available, to consider their reliability, how they should be interpreted, and ultimately how research integrity can be improved as this discipline continues to expand. So I'm going to move on to discuss some limitations of both HealthcareLCA and the evidence base more generally. Firstly, it's important to recognize that HealthcareLCA is not a living systematic review. We don't critically appraise studies, and therefore we don't provide users with any indication of study quality. Analysis of our data, though, suggests that the current evidence base is highly heterogeneous. Methodological terminology among included studies is used quite inconsistently, which makes it difficult at times to reliably code and extract data. Furthermore, around 1/3 of studies don't make any reference to an established methodological standard, which I think is a pretty strong indication that the quality of studies within the database is going to be quite variable. So this table here is looking at the proportion of HealthcareLCA studies that reference different carbon footprinting and LCA standards. And I think it's worth noting that it's simply referencing a standard by no means indicates that it was adhered to. So due to this underlying methodological and contextual differences, I suppose, that exist between available studies, we encourage users of our platform to exercise caution when interpreting recorded impact estimates. We advise against directly comparing studies with different methods and suggest that any conclusions drawn about the relative impacts of one product or activity or system over another should be reevaluated as new evidence becomes available. There is quite a lot of work underway to improve the quality and standardization of healthcare-related environmental impact assessments, including a forthcoming healthcare-specific LCA reporting framework called EcoHealth. Longer term, as evidence continues to accumulate, such efforts might enable data harmonization and aggregation that could ultimately provide us with stronger conclusions and about healthcare's environmental impacts, and really help, I guess, map out a pathway to net zero more clearly. So in closing, I just wanted to summarize a couple key points or thoughts. Firstly, the healthcare sustainability science literature is rapidly expanding, yet the environmental impacts of many thousands of healthcare products and activities remain unknown. Along with growth of this field, I think there's really been an increasing interest in how we translate this evidence into more meaningful clinical practice change. Conversations about how to incorporate sustainability considerations or outcomes within health technology assessments and randomized controlled trials, even clinical care guidelines are, I think, becoming much more mainstream. Secondly, while there's this increasing impetus for change, I think it's important to acknowledge some of the real limitations within the current evidence base. Existing studies, as we said, are highly heterogeneous, and And I think anybody who works in this area will appreciate that methodological decision making has a huge impact on the resulting environmental impact estimates. And as such, I think we need to be cautious and drawing comparisons and making generalizations, or even aggregating data from different data sources, as tempting as it might be. Finally, to address some of these challenges, we need to improve the conduct, reporting, and evaluation of future studies. While new healthcare specific standards will certainly help, I think this is ultimately a field that really necessitates strong collaboration between disciplines, between those with the clinical and system level expertise and those with the technical footprinting expertise. So I think that's really everything I had planned to say. Thanks to everyone for joining and for listening, and happy to try and answer any questions. I know we have a little bit of time. I perhaps didn't talk as long as maybe Daniel was going to. So yeah, happy to answer any questions. Thanks.
Thank you, Jonah. That was excellent. And thank you for leaving some time for questions. I have three, and I want to encourage the audience. Again, you can leave your questions in that Q&A feature at the bottom, but we'll start with the three here and then continue. So, Jonah, you touched on some of the key areas where the environmental impacts of healthcare could be reduced. I'm wondering if you could expand on those a little bit for us.
Yeah, sure. I think this question comes up a lot. And I think it's natural for people to want something to grab hold of, something they can implement in their own kind of workplace, for example. Um, there are definitely examples of this, and I think it really depends on which area of the health system one has a degree of control over. Um, Desflurane, which is an inhaled anesthetic gas, is one that gets mentioned a lot, um, given its very high global warming potential. And I think something like 100 hospitals I saw recently in Canada have now phased out or committed to phasing out desflurane in favor of more environmentally friendly options, other inhaled options or intravenous anesthetic agents. Propellant-based inhalers also have a significant footprint, and there are effective alternatives such as dry powder inhalers that can be used. Then there are kind of more, I think, system level interventions, like serving plant-forward menu options to staff and patients, prioritizing circularity and equipment supply chains, and so on. Obviously, ensuring that healthcare buildings and modes of transportation are renewables based. I guess I think I'd emphasize the importance of kind of upstream thinking. We need to prioritize reducing health service demand first and foremost. And I think we achieve that through strong public health and preventive care measures. And we also need to ensure that we're providing the right care. And by that, I mean, avoiding care that's either harmful or ineffective. So I guess, like in all sectors, it's really a combination of demand and supply side measures that are ultimately needed. Does that answer your question?
Yeah. That was perfect. Thank you. We have another question from Hoel. Are there plans to also include impact estimates directly from the industry, like publicly available LCA reports for specific products and EPDs? And if so, what would be the main challenges for achieving this?
That is a good question. Yeah, I think originally when we first started compiling the database, we were quite generous with what we included. Like there wasn't a whole lot available at the time. And so I think at that time we were kind of, as well as kind of monitoring kind of, bibliometric databases and finding journal articles, we were also kind of scraping the grey literature and identifying reports and so forth. Since then, and largely based on capacity, and I suppose probably our main audience being kind of academics and clinicians, we kind of have transitioned to focusing mainly on journal articles. It's certainly not to say that other reports, industry-led reports, or just reports in the grey literature in general, aren't useful. I think it would be great to include them if we could. I think it's fairly easy to kind of categorize things and make it clear where they're coming from and perhaps how they're funded as well. I think that transparency is quite easy to achieve. I think, yeah, the hard part is having a reliable system to be identifying those. We're always open to people notifying us of new studies, and we even have a form that authors can complete that helps populate the database and then gets reviewed by our team. So yeah, I don't know if I quite captured the entire question, but there's a first go at it.
Thank you. So this next question I have, so I worked on meta-analyses as an undergrad and in grad school, so I'm a little more interested in the methods behind HealthcareLCA. So how do you can you summarize how you identify new studies for the database and how they're incorporated?
Yeah, I think I have a slide on this somewhere, but the database essentially grew out of a systematic review we undertook at Dal in 2020, and that was specifically focused on surgical and anesthetic related life cycle assessment studies. And then we kind of had the idea to expand from there, since the field was quite small, and include other healthcare fields and disciplines. So initially we used mainly a process of kind of iterative citation networking, based on kind of the relationships between the studies that were already in the database, already in that review, and kind of expanding from there. We also set up various alerts across different bibliometric databases, including Google Scholar, PubMed, Scopus, and Embase. And so I guess more prospectively, we receive weekly alerts from each of those database based on our query strings that we have. And from there, I guess the process is relatively straightforward. We screen the alerts. We identify the eligible studies based on some very simple inclusion-exclusion criteria. We extract the relevant data and upload it. As I said, we have a system for authors to input data. So when we identify an eligible study, we first contact the author group and ask them to complete a form. They may or may not do that, but if they do, it's very helpful. And then that data gets reviewed, or Sage, our data analyst, compiles the data from the relevant study and uploads the information. So I suppose the database, as I said earlier, isn't like a living systematic review. We don't, screen 100% of what comes through. We prioritize relevance, and we don't have like a dual reviewer system. So I guess we're not trying to do that as well. I think that's kind of beyond our scope right now and our resources. Aside from that, I think looking forward, there are challenges. Like even our alerts that we have initially might have, given, 30, 40, 50 kind of studies a week. And now we have, just based on the growth of literature in general, we have kind of several hundred coming through. So it quickly becomes infeasible. So I think we're in the process of kind of exploring different avenues for how we identify and put data. And there are lots of different platforms these days that are there to assist with the automation of entry prioritization, like screening, and also to a certain extent data entry. So yeah, I think we will have to pivot a little bit moving forward, but for now, that's kind of the approach we've been taking.
Thank you. That sounds like a good problem to have. More and more data is always exciting. So from your experience, and this is the last question we have, are there any key areas where you think more studies are needed in your database?
Yeah, definitely a fair question. I think this is a young field of research. There's no shortage of research gaps really that need filling, I'd say. I think it also depends partly on the scale that your analysis is tackling. So I think at the product level, um, I think increasingly there's an expectation that you'd be undertaking kind of more of a full kind of cradle to grave analysis, and ideally reporting on multiple environmental impact categories, not just climate change. Um, at the kind of procedural or kind of intervention level, I think there's a push to model kind of entire care pathways, not just kind of if it's a surgical procedure, focusing on the intraoperative period, like within the operating room, but the kind of broadening the analysis to look at kind of the pre-operative period in terms of appointments and travel, and also the post-operative period in terms of follow-up and that sort of thing. And I think our um, understanding of kind of hotspots and relative impacts changes quite a lot when you take more of a broader view of things in terms of the impacts that patient diets and patient transportation might have compared to the medications and the building energy use that goes into just the one or several hours that they're in the operating theater. At the kind of more system level, I think there's a push to kind of hybridize those studies. So in other words, supplement spin-based input-output models with process-based activity data wherever possible. To better account for kind of those kind of high impact things like anesthetic gases and inhalers, but also other things that might not be captured in a input-output model like staff transportation, etc. If you actually go to the HealthcareLCA database, there's or on the website, there's a tab called charts, and on that you can see the database broken down in different ways. For example, you can see it based on discipline or healthcare field, which I think can be helpful for identifying perhaps less studied areas of the health system. I can't say off the top of my head which ones right now, but that could be interesting if you're thinking of getting involved. Ultimately, though, I think it's really about gathering the right expertise on your team to ensure that the results of your study, kind of whatever you choose to focus on, are both meaningful and also reliable. Yeah, I suppose that would be my advice. Thanks.
Well, thank you. So if anyone is planning a healthcare related study, check out that resource so you can know, where's a good gap to fill in your planning. But I just wanted to thank Jono and also Daniel, who couldn't be here, for preparing these slides, giving such a great talk. This is really exciting. I love a good database, so I'm really excited to see how everyone can use this and see how you continue to grow and pivot as you get more data. Thank you all for joining today. This will be available on our YouTube, and we look forward to seeing you at the September edition of our Brown Bag webinar. Have a great day.